Calcium. Today I will talk about an important mineral which makes most of our bones and teeth. It is located just below magnesium in the periodic table and has some properties in common. You are right, we are talking about calcium. This mineral is well popularized in different advertisements, especially in dairy products. We require calcium for building healthy bones, teeth, muscle contraction, nerve impulse transmission, regulation of heart rhythm, and activating blood clotting factors. About 99% of calcium of body is stored in bones and teeth, while the rest 1% is utilized in blood, muscle, and other tissues. Sometimes milk and calcium go hand in hand, and people are encouraged to drink milk to build strong bones. Good sources of calcium in diet include dairy products, salmon, green leafy vegetables, beans, seeds, and soy products like tofu and soya milk. Body gets calcium either by food or by taking out calcium from bones if you are not getting enough calcium in your diet. Let's talk about some good sources of calcium in diet. 1 cup 237 ml of cow's milk has 276 to 352 milligrams of calcium. The calcium in dairy products like milk, cheese, yogurt is absorbed at a much higher rate than calcium from other sources like spinach, beans, broccoli, sweet potato. Yogurt. Yogurt is a rich source of calcium along with healthy probiotic bacteria. Eating yogurt is associated with better quality of diet. About 270 mg calcium is present in 1 cup yogurt. Studies have revealed that people who ate yogurt have lower risk of metabolic diseases like type 2 diabetes and heart disease. Cottage cheese. Half cup cottage cheese contains 125 mg calcium. 1/4 cup sesame seeds contain 280 mg calcium. 2 tablespoons chia seeds contain 179 mg calcium. 30 gram almonds has 75 mg calcium. 100 gram broccoli has 47 mg calcium. 100 gram spinach has 99 mg calcium. However, they are high in oxalates which bind to calcium, making calcium oxalate that makes some of the calcium unavailable to your body. Beans and sweet potatoes are also rich in oxalates. Yet another compound which hinders calcium absorption is phytic acid. It is found in foods like almonds, beans, sesame seeds, walnuts, and cereals and legumes. If you are following a balanced diet, it is not much concern. The phytic acid content can be lowered by procedures like soaking, sprouting, and fermentation. Salmon is also a good way to get calcium and vitamin D naturally. The human body is in a continuous state of bone remodeling. By this, old bone constantly being replaced with new synthesized bone. The bone cells osteoclasts break down bone if calcium is required, while bone cells osteoclasts build the bone by the process of ossification. Till the age of up to 30 years, bone production exceeds bone resorption if the individual is taking enough calcium in their diet. As the aging process starts, the bone resorption exceeds bone formation. Hence, achieving optimal bone stores up to the age of 30 will provide an important base for later ages in life. The imbalance between bone formation and bone destruction leads to weakening of bones, which is commonly referred as osteoporosis or porous bones. This loss of bones is attributed to various factors. In postmenopausal women, bone resorption rates are much higher due to the deficiency of estrogen as the result of menopause. Similarly, lower level of testosterone in men can lead to osteoporosis. Although the risk of developing osteoporosis is delayed by about 5 to 10 years in men than women, other factors which contribute to the bone weakening are genetic factors and low physical activity. Vitamin D is an important factor which plays key role in maintaining bones. Studies have revealed that adequate vitamin D in diet can decrease the risk of hip and non-vertebrae fractures. Whenever calcium level in blood begins to drop, the conversion of vitamin D to its active form is initiated. It goes to the intestine to help the absorption of calcium to the blood and travels to the kidneys to minimize the loss of calcium through urine. Vitamin K is another factor which plays an important role in bone formation. Vitamin K is mainly found in green leafy vegetables like spinach, turnip greens, mustard greens, etc. It is also found in vegetables like cauliflower, cabbage, broccoli, etc. In case the level of circulating vitamin K is low, it may result in low bone mineral density. So how can you slow down the process of osteoporosis after the age of 30 years? First of all, by building a strong foundation for the later ages. So you must focus on building densest bones possible up to the age of 30. Get into regular exercise schedule. Engagement in weight bearing and muscle strengthening exercises. Getting enough vitamin D via sunlight exposure and eating healthy diet. Consuming adequate calcium through diet so that calcium is not drawn out from the bones. Having adequate vitamin K in diet. Vitamin K is another factor which plays an important role in bone formation. Vitamin K is mainly found in green leafy vegetables like spinach, turnip greens, mustard greens, etc. It is also found in vegetables like cauliflower, cabbage, broccoli, etc. In case the level of circulating vitamin K is low, it may result in low bone mineral density. So how can you slow down the process of osteoporosis after the age of 30 years? First of all, by building a strong foundation for the later ages. So you must focus on building densest bones possible up to the age of 30. Get into regular exercise schedule. Engagement in weight bearing and muscle strengthening exercises. Getting enough vitamin D via sunlight exposure and eating healthy diet. Consuming adequate calcium through diet so that calcium is not drawn out from the bones. Having adequate vitamin K in diet. Limiting caffeine intake, as many studies have linked higher caffeine intake to promote calcium excretion in urine. Retinol, also known as vitamin A, is a vitamin found in food and used as a dietary supplement. Studies have shown that too much retinol can promote incidence of fractures in low vitamin D intake groups. Consuming a very high protein diet for a long time may weaken bones as per some studies. However, the data is still insufficient and more research is needed in this area before we reach any conclusion. Hormone replacement therapy might help postmenopausal women to counterbalance for drop in estrogen levels, thereof preventing bone loss. But studies have depicted its side effects like increase in the risk of breast cancer and increased risk of stroke. Adequate intake of calcium helps in maintaining the bone health, lowers the risk of high blood pressure, lowers the risk of colon cancer. However, too much intake of calcium in diet was found to be linked with increased risk of prostate cancer in men as per a study. Hence, only adequate amount are considered safe for intake. Similarly, too much intake of lactose in diet is linked with increased risk of ovarian cancer in women. Higher calcium levels in blood could activate blood clots or may result in calcium deposition along the walls of arteries. People can get adequate calcium through their diet. If you opt for supplement, choose that contain vitamin D along with calcium, as taking calcium-only supplements may produce unwanted side effects. Analysis study have linked calcium-only supplements may increase the risk of fractures. There is a growing evidence that calcium-only supplements may also be linked to the risk of heart attacks. Calcium-only supplement is also linked with increased risk of colon polyps and kidney stones. However, before opting for any kind of supplement, do consider talking to your nutritionist or doctor. So, the take-home message is that adequate calcium and vitamin D as part of healthful diet along with physical activity tend to reduce the risk of osteoporosis in later life.